All right, Robin, would you like to introduce our speakers today? I'd just like to say a real quick thing before we do introduce. Dr. Emilio and I are close personal friends. I've loved the man since the first day I met him. He's been a very special part of my life, and he saved my wife's life the day that I went to go see him. So even if he doesn't have anything good to say, I tell you what, he's a wonderful man to listen to, and he's got a heart of gold. He's a great listener, a great friend, and he's a great doctor. So I don't want to take anything away from what Robin's going to say, but welcome. It's my pleasure to have you here with us, and bring your friends and co-workers with you today. Thank you very much. I look forward to it.
All right. Thank you, sir. All right. Cutting-edge technology and collaboration in our beloved community. These are just a couple of the reasons that Dr. Emilio Ramirez is so highly heralded in San Miguel and elsewhere. As an emergency medical specialist, he's bringing unique advantages to our community's healthcare. Dr. Emilio is the director of Hospital Joya, where he aims for unparalleled care, safety, and patient satisfaction through innovation. Please help me welcome Dr. Emilio, because we are very, very blessed to have so many medical resources in this town, and we need to know everything about all of them, and he's here to tell us. Thank you, Dr. Emilio.
Good morning, everyone. I feel very honored to be part of you this shortly time this morning, but I appreciate your invitation, and I hope we can contribute with you and your projects and everything. I just want to introduce my team. David is the guy who cares about the insurance, nationals and internationals. Dr. Chavez is our medical director, and Cynthia Parada is the public relations lady. Okay, we have short time, so I'm going to try to be short on this. As you know, emergency medicine is a field on the medicine that, like in a bullfight, we don't know how the bull comes. So we need to do the first, how you say that, capotazos, to check how the bull is and how we can do it. But the most important is to do it the best and the most rapid that we can, because life is a matter on these things. Kind of definitions of emergency medicine, we have a lot, but I think it's the most important specialty in the field, because we have to do rapid decisions and do it good, because we can lose a life or a part of your body, or definitely catastrophic issues. It's a not very old specialty, has about 55, 60 years in the US, and as you know, most of the times the emergency rooms were commanded for another specialties, surgeons, orthopedics, internal medicine, but then the world say we need a specialist in emergency medicine that covers all the specialties, but the most urgent in all of them. Unfortunately, there's a lot of countries that they don't have emergency physicians, which is a loss of time and frequent misdiagnosis, which could be serious. After the earthquake in Mexico City in 1985, a lot of people died not because of the earthquake by itself, but for complications and being in the hospital and the doctors trying to help, but they were not very well skilled to determine the injuries, and they died because of that. So that was a trigger to start with the specialty in this country. So the first doctors finished their residence programs in 1989. In San Miguel, fortunately, we have the only hospital with full-time emergency physicians 24/7, and that's Hospital Joya. Okay. There are 5 doctors. We're preparing in morning, afternoon, and night shifts, and the weekend. Dr. Cordero, this guy, was the founder of emergency medicine in Mexico. We had a meeting in Puerto Vallarta, and he's still working for these projects. What does Hospital Joya cares? Well, we believe that emergency medicine and critical care are the most comprehensive and life-threatening conditions. So that's we are focused on these 2 things here. We're trying to have everything to provide the most urgent care as you need or community needs. As I told you, it's the only private hospital. We have emergency physicians 24/7. We know time is life on this matter. Emergency medicine has a wide variety of diseases that we can check and treat at the moment. Some of them are one of these. The trauma, which is very frequent here. Cobblestones are very good for us. San Miguel fallen women. But one of the most important things is the heart attack. Heart attack, as you know, is something that we need to do it, diagnose and treat as fast as we can. We have only a few hours to provide some treatment, and we can recover if it's doing good. So one of the symptoms, or most common symptoms, is the pain, chest pain. But sometimes we can associate with some other things that we need to know. If we suspect that we are having a heart attack, don't lose time. Okay, call the emergency number, get an ambulance or some relatives, some friends, and take you to the hospital. Some hospital who has emergency physicians has most chance to diagnose and start treatment faster. If you are not allergic, we recommend to take an aspirin. What to do in the hospital? Well, one of the most useful test is the EKG. As rapid as we can have one, we can determine if he's having a heart attack and if you need immediate treatment. We have a few options for this, but that's one of the most. The same for a stroke. It's mostly the same pathology. I mean, a clot travels from some place in your body and is stuck in some artery, and this artery could be in your brain. One of the most remarkable signs for stroke, if we can learn this, be fast, but most is related to loss of strength and deviation from one side of the body. So that's an emergency too. We have to go. We need to perform either, come to the emergency room and be sure that your hospital that you're going to has available either an MRI or a CT scan. Those are the most important equipments that we need to have to diagnose a stroke. Because as you know, we have 2 types of stroke. One is ischemic, with the clot travels, or an hemorrhagic stroke, which is different. So that's the very important decision when we have a CT scan. If it's bleeding, we cannot give blood thinners. But if it's not a bleeding, if it's ischemic, we can do something, okay? As soon as we can start with these evaluations, the best will be an MRI with a stroke protocol, which is ready in 4 minutes. Joya is the only hospital with an MRI working 24/7, and we also have a CT scan. And if it's possible, we need to start the treatment. The thrombolytics is the gold standard for these treatments, Actilis or Acteplasa or Tenecteplasa. That medicine dissolves the clot, and the chances for recovering is very high if we do it right. Obviously, it has some risks, but the benefit versus risk is more the benefits. But remind, we only have 4 hours and a half to do everything here. I mean, since the patient starts with the symptoms till we give the medicine. So we don't have a lot of time. After that, it's useful, okay? So remember where to go. Be sure that you have emergency physicians, you have an MRI, you have an echocardiogram, electrocardiogram, you have the treatment, and those are good to remember. So be sure the hospital has these movie actors, and we can help on these critical issues. Those are the equipments. This is the MRI and the CT scan. Very similar but different. CT scan is X-ray and MRI is magnet. It's not radiation. The EKG, as I told you, the medications. That's how we can see brain on the MRI. It's more accurate, more good definition. Definitely is better than the CT. But in emergencies, if we don't have the MRI, we can do the CT. And we are looking for bleeding. That's the main target. In the MRI, we can see early stages of ischemia or loss of blood flow. That's how it looks like. Okay, we contribute with so many associations and enterprise that gives cares here. And what's next? This is very important. This year we're going to try to have our cath lab on the hospital. Right now we're using either MAC or Querétaro's hospital cath lab for intervention. We are finishing our blood bank. We're going to have an obesity clinic, breast clinic, nuclear medicine, and an oncology center. Those are the projects for this year. Hopefully we're gonna make it. And this coming month and May, the 17th to the 24th, we're gonna have a campaign that we call Kids First. And it's a journal of surgeries for orthopedic conditions for children without resources. That's all for free. We usually have about from 40 to 60 surgeries in those days. There's a team of doctors who comes from the States, and we provide everything in the hospital, the operation room, everything necessary for these journals. It's once a year, and it's coming in May. If you know some people that could be interested or have some conditions that probably require some surgery, please tell them to go to Joya and we can help on that, okay? And we're doing monthly health talks in some places, and we can, through Joe, let you know when are the next meetings if you're interested. It's directed to medicine conditions, and we're trying to bring specialists in different areas to different topics, okay? I'm gonna leave my friend David to explain you about the insurance that we do, how we do insurance things here.
Good morning. My name is David. I am the general manager in the hospital. I handle all the international insurance with national insurances. What I see from the beginning of the case, what's the way we see it, is patient gets to the hospital, emergency situation, first thing first. We always handle the emergency first, and then from there, we start seeing, well, the difficult part, which is the money, the administrative part. Hopefully, if we already have a workup case or a workup paperwork, we try to have all that information beforehand, just so we know if the patient has insurance, if they have a next of kin, because sometimes they, show up to the hospital alone because of the emergency or because a neighbor brought them and they don't have any information. But initially, how we work with the insurance, what Hospital Joya as a private hospital and how it works with your private insurance. I know there's Medicare, supplement plans, review of benefits, insurance companies we work with, and then Hospital Joya, San Miguel de Allende works with your international. I'm gonna shorten it up because I know this is a very long talk, but I'm gonna shorten it up as much as I can. Medicare outside of the US does not cover. I know people have said, and there's speculations, and there's groups who say that they do work outside the US. It's not possible. There is supplement plans and advantage plans that might cover you in case of an emergency, but that's through payment and reimbursement. If you have any doubts, one thing that we do in Hospital Joya that no other hospital does is that you can come in, have a one-on-one with me. We'll call the insurance company. We will, get them to talk about your policy, see what you do and do not have. Maybe you can get a guarantee of payment directly to us, and then the payment is just billed to the hospital. The patient doesn't have to worry about anything like that. But, all right, I'll say it again, Medicare does not cover outside the US, and it's, disheartening hearing that people are trying to sell people that and try to get them to work with them because all they want is to see how they can, weasel the way in and get information, and then later it's worse than better for the patient. So what we do is we detail everything. So if you show up to the hospital, you have your Medicare card and a supplement or an Advantage plan or a private insurance, we will take the steps we need to do, which is we will call the insurance company. We'll let them know that the patient, one, is in the emergency room and that they, had such and such diagnosis, and we want to know what kind of benefits they have. Sometimes the insurance company will tell us, I can't talk to you because I don't know who you are. You're calling from some random number in Mexico, and how do you have all this information? From there, it's a step-by-step, sending, okay, give me an email. I will email you the emergency notes, ID of the patient, insurance card, and then if the patient is able to speak, we'll get the patient on the phone just to, confirm that they are here, they are who they are, and I am who I am, just so we avoid any type of situation. From there, we will wait for the insurance company to send us some type of response stating that the patient does have some type of benefit of guarantee of payment, which means it's a legal document stating that the insurance company will pay the hospital depending on what kind of plan they have. Most of the time they'll cover 100%. Sometimes they'll say, the patient has a co-insurance or deductible. Those details, we'll talk it one-on-one. But most of the time it's clean and there's no trouble of, trying to bill them. There are certain insurance companies who'll say 30 days to 60 days to 4 months to a year. Sometimes we will ask for a deposit initially just so we have some kind of form to, pay out the doctors, pay out if we have to get some kind of medication, or like Dr. Ramirez says, we have to go to a cath lab in a foreign hospital. Well, we have to pay them immediately or depending on kind of contract we have with them. So a deposit at Hospital Joya will always be first thing after the emergency. We'll see what the care is, what initial medications and doctors will see you, and then from there we'll speak about what kind of deposit will be needed. From there, it's this one. We work with various insurance companies from the U.S., outside of the U.S., and foreign countries, Latin America. If you don't see your insurance company here, do not worry. We work with all insurance companies. We will call them. We will let them know that we are open to receive any type of guarantee of payment as long as it's from a formal email and we have a formal written document stating that they will pay out to us. This is Canada, and then Europe and Latin America. They all work perfectly, but more than anything, like Dr. Ramirez says, emergency medicine is unexpected. It's something that we do not know when it's going to happen. We don't like that. We know that might happen. But one thing I can say is that if we can prevent the paperwork follow-up, it's a lot easier. So if we can get you to come in with us, we'll do a one-on-one. We'll look through all your information. We'll have you on file. So if you do have even the normal doctor's consultation and your insurance company does cover that, you won't have to do all the paperwork. We'll help you with that. We'll get all them initial medical notes, the lab works, the workups, and then we'll help you send it off if your insurance company doesn't do direct payment. If it does reimbursement, we'll help with that all, so you don't have to deal with them and the headache of they won't respond, they won't give me any type of information. And we do all that just so we can help the patient and the family members worry about what's important. It's the recovery of the patient and the follow-up. So, I think this is the last slide. Oh, there it is. So if you have any information that you would like to send, or if you like a one-on-one, you can call Hospital Joya, or you can email me, which is gerenciaadmisión.sma@hospitaljoya.com. You can send an email stating you want to have a conversation about your insurance, you want to check benefits, you want to check, what kind of information do you need in case if you have an emergency. One thing right now we're trying to implement in general with the population here in San Miguel de Allende is to always have some kind of next of kin, a best friend, someone that can come in with you and help you throughout the process of an emergency situation, because right now we've seen that a lot of patients come in alone, and then they come in with the nurse or the neighbor or the gardener or the taxi driver that they know, and then trying to get information from them is very difficult, especially when it's time to talk about money, because they're like, I just work for them, or I know them, or I'm their neighbor, and I just happened to come by and knock on the door, and I didn't hear from them, so I opened the door and they were on the floor. And then from there, it's a whole process of trying to contact a family member who can make decisions on their behalf. And that's one thing that we should all start thinking about is, in case of emergency, who would be my next of kin? Who is my best friend that can take legal action in case of anything needs to happen? What's going to happen with my dogs or my cats in case of some kind of things like that. So some things we can have a food of thought. All right, then I don't know if we have any questions. Yes, ma'am. The lettering? Yes, it's quite long, so it's GERENCIAADMISION dot, because a lot of people forget the dot, SMA@hospitaljoya.com. Yes, ma'am.
David, if we do have an emergency, many of our insurance companies in the U.S. will cover the emergency. Is it your office that handles the paperwork to submit to our companies?
Yes, ma'am. It's all handled directly in the hospital. We don't work with any third parties. We don't work with somebody outside the hospital. It's all internal. Everything's sent out from this email, hospitaljoya.com. It's all internal information. We don't sell information. We don't give information to anybody who supposedly is working with the insurance company, unless it's like Blue Cross Blue Shield. They work with a third party called GeoBlue, and that's the only people we would mostly send them information to.
I had an emergency, and I paid up front, of course, and then I submitted the paperwork, and I was reimbursed eventually by my company in the U.S. And I just want to know that you're the person that we go to make sure we have the paperwork to submit.
Yes, ma'am. Absolutely.
Thank you.
Yes.
Anybody else?
Any other questions? Any questions for Dr. Emilio, maybe?
Who needs it?
That's right. You mentioned earlier about Kids First, and I know that they've been coming to San Miguel for 19 years. Is there any chance that you guys are going to put up a poster or anything so that people know the process to refer children to the surgeries? Or are they opening it up to adults as well now? Because my understanding is that it was always children.
Yes, this campaign is for children. And of course, we have the information. We can share it with you through email. If you email David, it's okay, and we can give you the information. You can share it to everybody. We also do a campaign for podologists, pediatrics, and that includes adults also. That campaign will be in August. So we can share that information to you, but that's different. That's for feet only.
Remind us, Emilio, of the dates for that, for the children's. Remind us.
We'll put it in the chat. May 17th through the 24th, right? Okay. Well, don't go away. I got to give you a nice fancy mug over here so you can drink your coffee out of it. Thank you very much. Anybody else have any other questions for the doc? Great to have you here. Get his picture. Get a picture.